Welcome to the Rehab Roundup. I am your host, Dr. Hassan, board certified physiatrist and independent practice owner. I help physiatrists start and grow their own independent practice so that they can achieve financial independence and live without limits. Welcome back to the Rehab Roundup for those of you who have joined us before, and welcome to the Rehab Roundup for those who are joining for the first time. Today's topic is how do we fill the void? This came to me out of my day today. Had a very interesting day, highs and lows. So early in the day, I had an amazing conversation with some young physiatrists who were hungry for knowledge about what to do when they transitioned kind of out of that initial stage of their career when they're kind of finishing up residency or just finished residency. And then also had a conversation or was on a webinar with some more well-seasoned physiatrists. Hey, Dr. Charlotte, thank you for joining. And there's a void. There is a huge void there. So in talking to the physiatrists who are more newbies, they aren't getting the knowledge on how to really be physiatrists when they come out. They're taught how to do it from an educational standpoint, but they're not really taught what to do from a business standpoint. And as a result, they don't see the benefit of the different aspects or practice settings. And so they choose a practice setting that they feel may be quote unquote more ideal, but they don't know that there are certain practice settings out there that can create an amazing lifestyle, but also from a career standpoint can be very beneficial and allow you to help a lot of different people. So I had the opportunity to briefly speak to them about some of the different practice aspects, and they were, eating it up. They were happy and more than willing to listen to more of the conversation. So that's something that I'm going to do in the next couple weeks with them. But then again, we had this conversation with some of the more seasoned physiatrists, and what they were talking about, which is impactful on so many different levels, is right now CMS is proposing that individuals, not even physicians, individuals who aren't trained in rehab medicine can now function as rehab doctors. All right, so I'm gonna let that sit in for a little bit. So individuals, not physicians, individuals who are not trained in rehab will now be able to do what a rehab doctor does. So think about this. So think about you have some type of coronary event, heart attack, and you go to a heart hospital, and an individual, not a doctor, is allowed to perform potentially cardiac surgery or do what a cardiologist or cardiothoracic surgeon does. It makes no sense. But somehow, some way, CMS has come up with this proposal, and now as a group of physiatrists, as a specialty, we now have to go about justifying what we do. I think part of that is because we aren't visible. So my business coach gets on me all the time about not being visible. He says you can't be the best kept secret. And I think as a specialty, that's what we're dealing with. People don't know what we do, what practice settings we work in and how we help people. So as a result, individuals can now say or now saying, hey, what you do isn't that important. All this specialty training that you have done over the past 4 years, someone who's not necessarily a physician can do the same thing and get the same results. Doesn't make any sense. But also on that particular webinar with those more seasoned physiatrists, I posed the question. I said, hey, what are we doing to the younger physiatrists who are in the field coming up to really teach them and educate them on the benefits of inpatient rehab? We know that there's a void and there's a need, but we aren't doing anything to let them know, hey, this is a great practice opportunity. You can set your own schedule. You have a patient population who really isn't really going anywhere. You can benefit them by helping them get better. And if you set the practice up right, you can really have a lucrative practice. Nobody's talking about that. And it's hurting us on multiple different levels, because if you think about it, if we get to the point where non-physicians are allowed to practice rehab medicine without having that training, that's going to adversely impact our patients. But also from a specialty standpoint, we're losing out on jobs. So it's hugely important for us to get activated, get motivated, but also we have to impart the knowledge and teach all the physiatrists who are coming up, transitioning into the practice, about all the different options they have. It's a passion of mine because 6 years ago, I was in their shoes, coming close to the end of my residency, trying to figure out, hey, what do I do next? What's next for me? Thankfully, I was in a program where it was kind of a hybrid. It was academic, but it was also private practice. So we got both sides of that coin, and it really taught me and prepared me to come out and be able to hit the ground running. So that's what I want to do for physiatrists who are coming straight out of residency, or who are in, their first couple years of practice, and even those who are already in practice and say, hey, I'm through with this, I don't know how to do this, or this isn't working right. Just empowering them with the knowledge to be able to really be effective at providing care in a setting that's hugely important. You got to think about it. You have all these individuals who are perfectly normal, perfectly fine. They have some type of acute event that takes them into the acute care hospital. And if they're single or don't necessarily have family, or even if they do have family, if they're not able to get back to their prior level of function, they need to go somewhere. And why not come to us in acute inpatient rehab to help them get better? That's what we're trained to do. That's our niche. That's what we do. So it's hugely important to me to be able to do that and provide that service to all these patients and families out there who need it. And I know there are awesome rehab doctors out there who may not know about how you can do this and do this well, and that hurts a lot of different people. So it's definitely a passion of mine, and I've been charged with being more visible, being more vocal, so that I can get out there. Hey, Dr. Nino, thank you for joining. So that I can get out there and really preach the gospel of acute inpatient rehab and talk about how you can help patients, but how you can also be very successful at it, and be able to create a lifestyle that you've always dreamed about. Who doesn't want to be free of student loan debt in 3 to 5 years, be able to take those great vacations, but also be able to come into the hospital and help patients get better, and kind of get back to life is kind of what I say. So something I'm passionate about. I'm definitely going to be more proactive, more visible. So this is a call to all my physiatrists out there who want to learn about acute inpatient rehab, learn how to do it well, all the different ins and outs, how you can set up a practice to be effective, efficient, be able to still have time to yourself. I know sometimes when we're going through residency, in a lot of the academic programs, because they don't necessarily know how to do it, it leaves a bad taste in your mouth. But I'm here to tell you that we can do it well, and be very successful at it. And I can teach you how to do it. So if you're open to it and you want that, I'm going to drop my scheduling link in a comment section. So hopefully you're tuning in, or if you're tuning in and you know a physiatrist who's kind of fed up with their current practice, or wants some different options on where to practice, how to practice, give them that link. We can get on a 15-minute free strategy session and just talk about it, and who knows where things can go from there. But like I said, it's a passion of mine, because as physicians, we help people. We do we're called to do an amazing thing for people who we don't know, but we don't necessarily take care of ourselves. And part of taking care of ourselves is understanding how this business of healthcare works, so that when we're doing this thing, we don't have a resentment for doing it. And as a result, we can continue to do great things for patients, save people's lives, increase their quality of life, and just overall help them in general. But we have to understand this. Listen, everything in this world is a business. And as a business, you want to be the best at it, and being the best at it is having all the knowledge about how it runs, how it operates, and how you fit into that. And I feel like once physiatrists understand that and learn that, then they'll see how great of an opportunity we have. Every day I wake up, I understand it's a blessing and it's a privilege to be able to do what I do and help the people that I help. But I also understand that it is a business, and if I do it a certain way, there are great results to that. So how do we fill the void? We got to fill the void, and part of that is getting the message out, talking to physiatrists at all different levels and aspects of their practice, and help them understand the business of acute inpatient rehab medicine. It's a great specialty because we can do a lot of different things, from outpatient to inpatient. Now with COVID-19 and how that's kind of changed the healthcare landscape, we can do telephysiatry. And then there's some other niche practice settings. We can do skilled nursing, long-term acute care. Sky's the limit. And I want to be able to get that message out there so people understand and actually take the opportunity, because CMS is on a path to allow other people to utilize that opportunity, and that's something that I am not okay with. We are trained and go to a residency for a reason. Rehab medicine is a real thing, and we do a lot of good to help patients get better. So I won't and don't want to allow anyone to discount what we do. Just because you don't necessarily know about what we do and where we practice doesn't mean that we don't have a true benefit to patients. So this is a call to action to all my physiatrists out there. I'm going to drop a link to my scheduling so you can get on a 15-minute free strategy call. We can talk about rehab. We can get you right, get you on a path to a great practice. I am Dr. Hassan, board certified physiatrist, independent practice owner. I help physiatrists start and grow their own independent practice so that they can achieve financial independence and live without limits. Again, I'm going to drop that scheduling link in the comment section. So if you know a physiatrist, rehab doctor, or even if you don't, Google one and give them that link so that we can get on a free 15-minute strategy call, because we are in danger of losing an opportunity to help patients. And that's not cool. That's not cool on any level, any form of fashion, because what we do is added value to patients' lives. So thank you. Have a good night. Look forward to talking to you soon.